Steve Andrews is giving a voice to the voiceless and taking the powerful to task. Now, 8 on Your Side investigates.
They depend on Medicaid to get them to their doctor. So not only are they sick, at times they're stranded. $100 million. That's what it cost you so far this year to pay to transport Medicaid patients in Florida to their doctors.
What level of service are these patients getting for that big chunk of change here we're talking about that you're spending? And based on the calls and complaints that 8 on Your Side senior investigative reporter Steve Andrews is getting, I mean, that seems like a valid question.
Oh, it is, because month in and month out, problems with Medicaid transportation are at the top of that Medicaid complaint list. Now, the company providing these rides contends it's doing a great job. Patients beg to differ. Diana Luczynski and other patients at the Pinellas Cancer Center rely on Medicaid transportation provider Logisticare to get to chemotherapy treatment.
They drop me off on time. They just don't pick me up when they're supposed to. So I have to wait each time longer and longer.
And I just have to sit there and grin and bear it, grit my teeth.
Al Cochran contends his Logisticare rides are routinely late.
I have an appointment for 1:30 to go out of county. I don't get there till 3 o'clock, and sometimes they don't pick me up till 3 and I get there late.
He complains it's gone on for years.
And I don't get home till 7 in the evening, sometimes because of that.
It is a problem.
Melissa Morris at the Best Treatment Network in Newport Richey claims one patient waited until midnight on Logisticare for a ride home. She adds, unless a patient is outside waiting, drivers stop for a minute or two, then take off.
Most of our patients are older, and they can't sit outside in the heat.
It's horrible. They don't care.
Kim Faulkner manages the Pinellas Cancer Center.
If they cared, they would be here to pick them up. They would wait 10 minutes if the patient wasn't, completely done. They wouldn't leave them in the parking lot. They wouldn't drive through the parking lot and not see anybody and keep going.
Logisticare says 99% of its trips in Florida go without complaints. Johanna Spaninato, a cancer patient, complained loudly. She's waited hours for Logisticare and has a message for its CEO.
I would tell them to wake up and get to work and see what the hell is going on in plain English with your company and the people that work for you. They can't do their job, replace them.
Now, according to Melissa Morris at Best Treatment Network, as well as Kim Faulkner at the Pinellas Cancer Center, every week, transportation snafus force patients to delay or cancel appointments for treatment. And of course, if that happens, then you've got the other end of the problem, which is delayed treatment means more medication.
Well, and I understand her outrage, but the question is, how do you fix it?
I think direct pressure, kind of like a wound here. Kim wants to meet with local lawmakers. She's already scheduled an appointment with them to make them aware of the problem. I've already touched base with Congressman Bill Arakis' office about this, but it sounds to me like Johanna has the solution here. If a driver can't get the job done or a company can't get the job done, replace them with somebody who can. Simple.
That makes sense. It sounds simple. We'll see. All right.
Sure.
Thank you, Steve. If you have a problem you want Steve to investigate, give him a call. The 8 on Your Side helpline number is 1-800-338-0808.